Fear of T3 by doctors. I really want to go over this with you face to face and not with slides because I think it's important to really dive into this. Here's the problem. So if you have figured out by going through this module that you indeed do need a little bit of T3, be it in the form of liothyronine, Cytomel, or NDT medication, then it's going to be a little bit of a tough conversation with your doctor if he or she is not open-minded enough and progressive enough and educated enough in the thyroid. They may present you with a false fear that the T3, number one, will not work. Number two, will cause heart palpitations and or a heart attack. And number three, will cause bone loss or osteopenia. So let's go over each of those. Number one, it won't work. Well, T3 is the active thyroid hormone, like we've discussed many times over and over. It is what runs the show. I have seen in 24 years of doing this, just by giving a patient a small amount of T3 and gradually working our way up to make sure that they tolerate it, to make sure that they do not go into a hyper state, which is very rare, as we've talked about, and to make sure that they basically feel good and their symptoms are reduced. T3 works. We do it slowly. Many times we'll start off with 5 micrograms, then go up to 10 micrograms. I've had some patients that start at 25 with no problem. As I've talked about, I am on 150 micrograms split dose of T3. It absolutely works, whether in a teeny tiny dose or a large dose, it absolutely does work because it is the active thyroid hormone. In Hashimoto's, it's the only medication, it's the only portion of the medication that really pushes down those antibodies and that makes them be suppressed, that actually puts Hashimoto's into remission. Fear number two, it's going to give you heart palpitations, heart attack, arrhythmias, only if you have a predisposition for heart issues. So if you've had a heart attack before, if you've been diagnosed with AFib, tachycardia, yes, of course, that is a concern. It doesn't mean that we don't use it. It just means that it is a valid concern. It is not, however, a valid concern if you do not have a predisposition for a heart condition. So let's get that right out there and push it away. The scientific studies are in. I will definitely link to them because I know I have some nerds out there that just love research like I do. So I will link to the studies that say, no, we're sorry. We were wrong all these years teaching these medical professionals that if you give a person T3, they're going to have a heart attack. That's not the case. Fear number three, bone loss. Again, I will reference studies. Totally, a complete misconception. So taking T3 medication will not all of a sudden cause your bones to deteriorate. Now, this is all provided that you are doing weight-bearing exercises of some sort, which we should all be, that you are on vitamin D with vitamin K and magnesium. That combination alone, which you should be on anyways, because it is good for your thyroid, and we'll dig deeper into that into the supplement module. But you should be on this anyways to protect your bone health and to support your bone health. That in combination with weight-bearing exercises will absolutely protect your bones. Adding in T3 is not going to make your body break down bone mass. It is not, especially at a low dose, enough to give you your life back and optimize your thyroid. No, no, no. Those fears are just that. They are fears. False evidence appearing real. Please do not let these fears get in your way of proper treatment. Do not accept that answer. It is coming from a doctor who is not educated and not updated in the thyroid. We'll be going over case studies and scenarios and dig into this so much deeper so you can compare it with your own. We'll be answering your questions in the Facebook group. We will get to your proper medication type, dose, and we'll move you on to a doctor that, again, red flag number two, if your doctor gives you those fears and refuses to treat you with a T3 medication when in fact you have figured out through working through this module that you need T3 in some form or another, then it's time to move on to a different doc. Remember, what red flag number 1 was your doctor refusing to test. Red flag number 2 is your doctor giving you lines of BS that simply aren't true as why they are refusing to treat your thyroid properly when you are suffering and there is an answer. So maybe time to move on to a new doc, which we will cover in a different module. But until then, I wanted you to fully understand the fears and the misconceptions that accompany a doctor saying no to T3 medication.